Good afternoon. Thank you for coming to Welcoming Wellness. We are an initiative of White Plains United Methodist Church where we are empowering mental health. I'm Robin, and I'm going to be working with you and with our speaker today in facilitating. Our main goal at Welcoming Wellness is to provide resources and education to caregivers of people who are working with people with mental illness. We are also hopeful that our efforts will help people to not be afraid to come forward, to reduce stigma, and to come forward when they need help. Let's talk about who we're going to hear from today. We're going to hear from Dr. Andrea Linares. Dr. Linares is an adult neurology resident at Duke University Medical Center in Durham. She's presenting a program today that was created by the Alzheimer's Association, and she's going to tell us a little bit about herself, and we are happy to have you.
Thank you so much, Robin, for that introduction. Like she mentioned, my name is Andrea Linares, and the reason I am here today is to talk about a topic that I'm very close and near dear to my heart for many reasons, both from professional and also personal reasons. Personally, my grandfather, who was the head of our family, unfortunately developed really advanced dementia. And watching him go through the changes and also the mental health effect it takes on the caregivers around him really motivated me to want to learn more about this disease. From a professional standpoint, I take care of a lot of Alzheimer's and dementia patients in my clinic as well as in the hospital. So I have had the opportunity to work with patients and families as they deal with this diagnosis, this disease, and through the difficult and also positive parts that comes with this. So the good news about this presentation is that we have a little bit of a combination. It's a little bit interactive. We'll ask some questions just to kind of test the knowledge. For all of these questions, you can just either shout them out loud, just answer them internally. That's fine as well. These are some of the learning objectives. I'll first want to kind of debunk a very common myth about learning and comparing what Alzheimer's and dementia is. We'll then recognize how Alzheimer's goes to affect the brain and how over time it continues to affect the brain. Then we'll start recognizing how Alzheimer's has various risk factors, and some of them might actually come as a shock. And then we'll identify not only the stages, but also identify what the latest research has shown to us in the last, honestly, 5 to 10 years and all of the advances that we have made. And then lastly, I'll go through a lot of really great Alzheimer's Association resources. Let's start with testing some of the knowledge about what the impact of Alzheimer's really has in our community. In the world, there's about 55 million people all affected by Alzheimer's dementia. In the United States, however, how many Americans do we believe are affected with Alzheimer's? Is it over 3 million, over 6 million, 8 million, or about 11 million people? I'll give us a couple of minutes or seconds. So it's actually more than 6 million people in the United States are living with Alzheimer's disease. Out of those 6 million people that are living in the United States with Alzheimer's disease, something that I think we definitely forget about in the healthcare world is not only how it affects those individuals dealing with it, but also how it affects their caregivers and their loved ones. So in the United States, how many Americans do we believe provide unpaid care for people living with Alzheimer's and other dementias? So believe it or not, over 11 million Americans are providing unpaid care for patients living with Alzheimer's and other dementias. They actually did studies, and this accounted for, it was about $200 to $300 million on unpaid work if they equate it out. They suspect that by the year 2050, we will probably get to close to $1 trillion. So these are very staggering numbers. So let's talk about some of the facts that are very common for Alzheimer's dementia. So as you could see, some of these numbers are pretty shocking. And I will be honest, even when I heard them myself and realized how many, not only Americans, are dealing with this disease, but also the caregivers and the financial burden that it takes on this country, I am becoming very passionate about being able to spread the awareness and giving facts about what it is to know like what dementia and Alzheimer's is. Now, it's a term that's actually very commonly used very interchangeably, the dementia and the Alzheimer's. But as you'll see in the upcoming slides and some of the videos, we'll actually explain that dementia is more of an umbrella term, with Alzheimer's being the most common cause of dementia under that umbrella term, accounting for about 60 to 80% of the dementias. So let's test your knowledge one more time. So true or false? Alzheimer's is a normal part of the aging process. Very good. Alzheimer's is not a normal part of the aging process. The way I like to explain it to patients is, as we age, our body ages with us, and so does our brain. But there are specific characteristics that tells us that it's not just normal aging, and it is something that we need to be talking to our doctors, our friends, and family about. The key with dementias is that it starts affecting our activities of daily living. It affects our mood and affects our cognition and our behaviors as well. Okay, let's do one more. People younger than 65 can get Alzheimer's. True. Although it is much less common, people under 65 can develop Alzheimer's, and this is called early onset Alzheimer's disease, and we do make this diagnosis. So let's hear from some of the experts, and these are videos that will highlight some of the things that I have mentioned.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual. But there is also some overlap in behaviors among the types of dementia.
And the key thing when we start thinking about these different types of dementias, and the reason in which we advocate so strongly to make sure that you speak to your doctors, are sometimes patients can develop reversible types of dementias. And these are usually dementias that are related to metabolic disturbances, medication overuse disturbances that start to actually fog or cloud the way in which our brain processes thoughts, emotions, and behaviors.
Certainly having the diagnosis of Lewy body was helpful in our planning because we began to understand where this was coming from in the brain, where otherwise we would not have known. Like we knew something was happening, but what was it? To give it a label actually helped, although it was a big umbrella. It explains some of the characteristics and symptoms that we were experiencing and seeing.
So we see the brain right there. Believe it or not, the brain only weighs about 3 pounds in a normal human being. It accounts for about 25% of all of the blood flow that our heart pumps. So a very small organ that is a very powerful thing. Now, as you will see in the next couple of slides, we'll start to talk and go deep into what actually does, like what causes dementias and other Alzheimer's. The way I like to explain it to my patients is just think about kind of deposits of junk or plaques that start interrupting all of those multiple channels that our brain has. Our brain is just a complete big network. And as we start developing and depositing those chunks into certain parts, it can start interrupting those communications. And that's why we start noticing difficulties with our communication, our cognition, and the behaviors as well. So more than 100 years ago, it was actually Dr. Alois Alzheimer's that described specific changes in the brain, which are the formation of these plaques and tangles. Then Alzheimer's causes these nerves to die, which leads to shrinkage in the brain. The brain changes result in changes in, like I mentioned, your memory, your thinking, and your behavior as you're interrupting all of those channels. A very common question I get asked is, what can I do now to start thinking about the risk factors I might have or others might have so I can be aware of how to best help myself for the future? So let's test our knowledge. In Alzheimer's dementia, what do we think is the most common risk factor for developing Alzheimer's? Is it genetics? Is it family history? Or is it age? It's actually our age. So although Alzheimer's is not part, like I mentioned, of normal aging, age is the greatest risk factor for developing this disease. After the age of 65, our risk of developing Alzheimer's doubles every 5 years, with about 34% of people over the age of 85 having Alzheimer's disease.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's, and when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
So when we start kind of breaking it down into populations that are at higher risk, we know that Black Americans are about twice as likely as white Americans to have Alzheimer's or other types of dementia. When we talk about the Hispanic Americans, they're about 1.5 twice as likely an increased risk compared to white Americans. And then about 2/3 of Americans living with Alzheimer's are women. I believe, yes. So as we know, in a short recap for some of the risk factors, we start worrying the most about age, especially after the age of 65. And we also have to take into consideration that other risk factors, although not as common, are family history, and having a parent or a sibling with the disease increases an individual's risk. We know that there are these risk genes and deterministic genes that are the two types associated with Alzheimer's. And then Black Americans and Hispanic Americans, as well as women, are at also an increased risk of developing Alzheimer's dementia. Now, what happens once we start considering dementia, and especially Alzheimer's dementia, as being the diagnosis? The next question I very commonly get is, what do I expect? How will this disease continue to progress? Well, I like to be transparent and say the disease will progress. Okay? Over time, the plaque formation and the deposits will continue to worsen and affect the way in which we behave, in which we act, in which we think, or even speak. Now, there are various stages to Alzheimer's dementia. So what we'll do is we'll hear from some of the experts, but the key is 3 main stages, and then we'll divide it into subgroups.
I'm like an overachiever. And when you're unable to deliver or you're not performing at the same pace that you once did before, that's frustrating. It's frustrating to not know where you place things. It's frustrating to not be able to explain to someone the problems that you're having. You can't articulate it in a way. It's frustrating to read something and you forgot what you read. It's frustrating to continuously have to change your password and you just changed it last week and you're constantly doing the same thing over and over again.
And then let's hear from Phil.
Math, I can't do a simple tip anymore. I sit there, I stare at it. it's crazy what numbers I can't deal with anymore. And in some ways, that's the disease to me. The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life. You know, as an avid reader, as a reporter, as a writer. I struggle with them now.
And lastly, we'll hear from Tom, who has Lewy body dementia.
I think the thing that surprises me the most about my dementia is that it is progressive, and I'm finding that I'm forgetting more. And they do memory tests for me all the time at the doctor's, and so that becomes a little disconcerting at times, to see my cognitive impairment continue to decline. But again, I really have hope. I don't live really in the future. I can't live in the future. I can't worry about what the future is going to bring. I have to live for today.
So I think some of these testimonials just kind of like give a face to the struggles that so many Americans deal with on a day-to-day basis. Now, when we start to talk about, the progression of disease, it's a continuum. The first symptoms is usually what we call asymptomatic. So as our brain starts to notice these kind of deposits of plaque, our brain is very robust, and it can recover, it can form new pathways. So sometimes we'll actually have no cognitive symptoms, but there already will be biological changes in the brain with the deposition of these plaques. What then starts happening is one of the first phases is MCI, mild cognitive impairment. And this is when we start developing more of the formal signs of Alzheimer's. Then we start actually having that diagnosis of dementia, which we then split into 3 subtopics. The key of each of these divisions is how bad does it affect your activities of daily living? Activities of daily living, the way in which we measure it in the office is, are you able to bathe yourself, dress yourself, pick up your own clothes, do just the basic functions for life? And then with the mild symptoms, you start noticing some difficulty with this. Once we start getting into the moderate symptoms, you'll then start noticing even more difficulty with these activities of daily living. And then severe is when you truly need and reach the point that you need more assistance than others to be able to get these tasks done on a day-to-day basis. As a quick recap, we saw that there are 3 broad phases of the disease. These are the asymptomatic phase, then we have the mild cognitive impairment, and then the dementia. And within that dementia, we further subdivide it into mild, moderate, and severe. It's really important to know that no 2 individuals will experience the same symptoms. We are all unique in our own ways. So as a family, as a support group, it's important to know that just because somebody is not following the typical trajectory of things, it does not mean that they are not experiencing dementia or symptoms of dementia. And then while symptoms may worsen over time, people can also progress through stages at different times. So some people can maybe accelerate in their disease process a little faster or a little slower than others. A very hot topic in the world of medicine and research today are FDA-approved treatments for this disease. What we do know is that it's important to talk to a healthcare professional, even when you just start having some of those initial concerns. Why? Like I mentioned earlier, there are reversible causes of cognitive impairment. This can be one of your vitamins is too low or too high, and it could be corrected and your cognition starts to clear up. You're taking too many medications that might be a little bit too sedating, and then maybe pulling back on some medications can also improve that cognition. Also, current medications, unfortunately, although they cannot cure Alzheimer's, there are medications that can help the symptoms associated. And recently, FDA approval has actually put on the market infusion therapies that helps actually some of that prevention of those plaques that I mentioned earlier. Now, I will say it is like the latest and greatest in Alzheimer's research and the latest developments. So it's not for every patient. And that's why talking to your doctor about what the options look like for each one of us is important. And then these treatments are a pill, patch, or like I mentioned, the latest therapies being intravenously. And having a conversation also helps us know, like, getting involved in treatment trials, which we'll hear about in a little bit, and also what options there are for each individual patient. So when we start talking about Alzheimer's research, we'll hear from Dr. Snyder and some other of our colleagues through Alzheimer's Association about even getting involved in trials.
This is an incredibly exciting time in Alzheimer's and dementia research. The advancements that we've made in the last decade to understand the disease as a continuum, meaning that the biological changes are starting a decade or more before someone is experiencing the changes in the memory and thinking. This sets the stage for possible prevention. The idea that when we have the tools to identify those individuals at the earliest time point, and when we have the interventions to target individuals at that earliest time point, we can intervene to stop or slow the progression of the disease before an individual loses their memories.
Growing evidence indicates that people can reduce their risk of cognitive decline by adopting key lifestyle habits. More and more research shows that factors like exercise, nutrition, and aggressive management of cardiovascular risk factors may impact our ability to slow cognitive decline as we age. And through current studies, we're exploring how certain lifestyle factors may even reduce the risk of developing Alzheimer's and dementia.
And the key things that I want to highlight and what she's talking about are the modifiable risk factors. So I always laugh with my patients when I say, you need to be sleeping well, you need to be eating well, because that's what we always hear. But research truly has supported. When we start to think about the root foundation of what keeps us alive, it's our heart. Having a healthy heart function, exercising, eating well, helps that reduction of burden that maybe the heart develops and then impacts the blood flow it supplies to the brain. Now, sleeping. Sleeping, believe it or not, is the best time for our bodies to truly rest and recover. Our brain, while we sleep, actually goes in and starts clearing out debris that might have built up. That's why research has told us day in and day out how sleep deprivation starts to slow our cognition. We start building a lot of that junk, and our body does not have time to clear it while we rest and get some sleep. For the diet, a common question I get is, well, what type of diet should I follow if everybody says healthy diet? There are two diets that I always recommend. The first one is the DASH diet, D-A-S-H. The second one is a Mediterranean diet. So the key thing is incorporating a lot of those vegetables and kind of like rainbow pattern into your meal. Avoiding those saturated fats, fried foods, red meats, and trying to think more about lean proteins like fish as well as chicken.
A lot of hope does come from the Alzheimer's Association, all the research that is being done. Even though there is not a cure today for the disease, I know in my heart there is going to be a cure one day, and I know we're getting closer for that cure. Because even if you fail in a research study, you learn from that failure in the research study. That failure always brings progression.
It's nice to see the association spearheading in many ways the emphasis on getting the money at the federal level and at the private sector to get the research done so that someday there will be an effective treatment, hopefully cure, hopefully prevention.
So the key thing about these clinical studies is that a lot of patients, even when they come to me in clinic, they don't know that these actually exist, right? Hearing about Alzheimer's dementia is scary. I think we're all in our heads are trying to process like, man, these are numbers that come very close to home when I start to think about the millions and the very common populations that are affected. But the key thing about these research initiatives that are done through the Alzheimer's, but also other organizations, is that it helps to give more information to truly help pave the future for what could we do for generations behind us to help them not deal with this disease.
Participating in a clinical study is one way that everyone can get involved in a very direct way in the fight against Alzheimer's disease. And for people who currently have dementia or Alzheimer's disease, there are some additional benefits. You get access to very close medical care. You also may be among the first people to have access to the treatments that will eventually prove to work.
You might hear the phrase negative trial, which means it didn't hit the endpoint. It didn't result in an FDA-approved treatment for the disease. But I think the only negative trial is one that doesn't provide us with valuable information. If the trial is well designed and is a good scientific experiment, we can get extremely valuable data that can help plan the next trial and make it even better than the last one. And it gets you that much closer to that FDA-approved drug, to that effective treatment, and maybe someday even prevention. By participating in clinical research, you can move us toward methods of treatment and prevention for all those affected by this devastating disease. Alzheimer's Association Trial Match is a free clinical studies matching service for those with dementia, caregivers, and healthy volunteers. To start, simply create a confidential user profile and receive a list of studies that may be a match for you. Don't just hope for a cure, help us find one.
Like you all saw, science really has come milestones just in the last decade. We have a lot of information that as providers we can give, but it's also important for the community to know things that you could do beyond just going to a doctor's office, about getting involved through participating in research trials, but also understanding who's at risk and what to do best to help mitigate or decrease these risk factors. Now, like I said, I am a volunteer through the Alzheimer's Association. So I do this truly because I want to be able to get this information out to the community. I did not have this information a couple of years ago when I was dealing with my grandfather and, being kind of thrown into the front line of, well, you're in medicine, so you're going to figure out what's wrong with your grandpa. I had no idea. So I'm so glad to know that now I can direct anybody from any stage, whether you are someone personally dealing with dementia or Alzheimer's, whether you are a loved one or a caregiver, also having to be with someone that is dealing with this disease, and how to best help them. These are resources that I'm very proud to show. So we'll first kind of see truly the effect that the Alzheimer's Association has. Everything in purple is where the Alzheimer's Association takes place. And these are community efforts, these are walks, these are just initiatives to really help with the goal of being in a world without Alzheimer's and all of the other dementias. Now, it's a very heroic goal, but I think it just kind of comes to show how passionate we really do feel about this disease. The Alzheimer's Association actually does provide 24/7, 365 days a year, free support resources. This is in the mode of a 24/7 helpline. That number 800-272-3900. You can also go on the website and see this presentation is on there, flyers to hand out to loved ones, and also in the community. You can also be community care partner. So if you feel passionate about this, or if you have a story to tell, I encourage everyone to come and just talk to others and be able to spread the information.
I've had a couple of phone calls that I've been able to make in to the call center when I've had a couple of quick questions that I wanted to ask. There's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did, was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
When I went to the Alzheimer's Association website, which is alz.org, there I was trying to find out more about what was Alzheimer's, what really is this disease, what is younger onset Alzheimer's, what is dementia, is there a cure, how long has this been around, how many people are affected by this? Where can I go for resources? Where can I go for help? What do I do with this? How can I handle this? Is there more people like me out there? Is there someone that I can talk to if I need to? And there I found the support line that's 24 hours a day. And there I found where I can go for workshops, where I can go and read things and postings that people have done, where I can find out what events is happening in the Alzheimer's Association, where I can see how it's affecting people around the globe.
Since I've been diagnosed with dementia, the one place that I know I can go to for assistance and help and support is to the Alzheimer's Association. There are people there that I know by name that I can contact if I'm having a difficult time or if I'm struggling to find some resource, that they will provide that to me.
You're here today, which means that you already kind of want to learn more about this, but there are also ways that you could go beyond just listening to my talk today. And it's just kind of, ways to join and be part of this initiative. And I will say there are lots. I wish I had more time out of the hospital because of how many opportunities there are. But, volunteer, something like I am. Just go out into the community, just talk to others. You can relate with others. You can just disseminate that information. You could also be an advocate. We also have colleagues that go to the White House and start talking to congressmen and start talking with politicians about the importance of funding, the importance of awareness for this disease. Trial match, like we talked about, those clinical trials that are available. And like I mentioned, it could be for healthy volunteers. It could also be for patients that are dealing with various stages of the dementia. And the Walk to End Alzheimer's, it is, I will say, a really great event. I love going every single year. You start to kind of build a community. And this year, every year, it's in downtown Raleigh area. And then the longest day, which is actually literally the longest day, which is at summer solstice, they do have kind of that day where we promote Alzheimer's Association and just kind of further push that raising of like awareness for further funding for research and also information from for the community. So I am so happy again. Thank you all so much for coming. It really does mean a lot. I feel very passionate about this. Of course. Serious concussion at a young age, 15. Could this lead to Alzheimer's? Very good question. So repeated head injuries can. The key thing, as we started to think about the various types of dementias, right? We talked about this umbrella term. Vascular dementia is the second most common type of dementia. This usually occurs when patients that have, for example, recurrent strokes, as they're literally infarcting various parts of their brain with each stroke, but also like we see in very contact-heavy sports like football. There is research that does say that unfortunately just repeated head injuries can increase your risk for cognitive decline to some degree. Now, maybe one concussion at the age of 15 and you've otherwise stayed pretty healthy and your head's pretty much kind of stayed intact, I think the risk is not as high, but recurrent head injuries can, yes. What Alzheimer's disease is genetically inherited? So the genetically inherited one actually is attached to a specific, it's called ApoE allele. So it's a genetic testing that is done. And one of the key reasons why we strongly encourage a patient that maybe starts to notice some cognitive difficulties, even though it might be mild, if you have a strong family history, you should go and see your doctor and you should consider maybe having that referral to the memory clinic where they do take a closer look at those risk factors, and that's actually a genetic panel that they send. ApoE being the most common gene associated with it, especially when you have kind of like the double presentation of that gene in your blood. If you suspect a loved one may show signs, early signs, how do you approach the subject without getting them upset? I really love this question. So the way in which I've taught it, I actually had a patient I was taking care of in the hospital that said, hey, like, you see my grandma over there? I think she's having some difficulties with her memory. So I started to, every single day that I'd go see this patient, grandma would be there, and I started to slowly just have a conversation with grandma. And I also could tell that there was some kind of difficulty in the way she communicated. Sometimes her behavior would be a little bit off. And the way in which I encouraged my patient to sit down with his grandma and talk to her was, hey, do you notice that maybe you're forgetting things? So try to get their point of view of how they think they've been doing. And sometimes, understandably so, we like to live in denial when we feel like something is wrong. We like to not agree with, wait, I think there's something off. So approaching it with, have you noticed something? Let's reflect. If you still find some resistance, you can bring up some examples, but just try to keep it lightly without being judgmental. I've had families take their loved one to their favorite park and just sit down for a picnic and say, hey, I love you and I am worried about you because I have noticed that you started misplacing the keys or you got lost while you were driving home from church that one Sunday. Things that maybe can kind of start bringing them into perspective as to, wait, I have had these difficulties over the last couple of weeks or months. And I think that's usually the approach I have. What can be done to delay / prevent or reverse dementia? So, like I mentioned, the keys, diet, exercise, truly healthy living. Other things that can be done is to have an open conversation with your loved ones if they start noticing anything that's off, but also that open conversation with your doctor. There are a lot of neuropsychological and neural memory testing that we do in the clinic very frequently. I have patients. No, you're good. I have patients that have followed me for years for, let's say, migraines, but then a couple of years they come back later for, I started, about 4 years ago. So like I had a patient come in and I always followed her for migraines. Then most recently she came in and she said, I have had difficulties with my memory. And for me, it's just printing out that memory testing and administering it. Because not only does it maybe give you a baseline if, let's say, the study is okay, but you can continue to test it and you can continue to talk about what medications can we maybe start coming off of? What medications do we no longer need that could actually be clouding our memory? So those are usually things that, yeah. Yes. So believe it or not, and actually research also has supported this, keeping your brain active, learning, engagement. So what you are all doing here today, that's part of keeping your brain active. Reading, doing challenging puzzles, I always strongly recommend that because our brain is always in the state of continuing to want to rebuild those circuits. So once we start kind of depositing the junk in certain parts of our brain, by encouraging our brain to think, then we challenge it to then form new circuits. So that can also be really, really helpful. So crossword puzzle, Sudoku, all of those kind of stimulating. I have a patient that always brings in the puzzles that he makes, and they are impressive, very impressive. Is it hereditary? There are some forms of dementias and Alzheimer's dementias that can be hereditary. That's why, depending on the family history, and it is unique for every single person, it's important to make sure that your doctor is aware of these to know if you maybe do need some of this genetic testing. A lot of times there's resistance to genetic testing. People will say, well, I think ignorance is a little bit bliss. I'd rather not know because there's no cure. So what will I do about it? But I think it's also important to know that there are symptoms that we can help manage. There are things that we can do in anticipation before they happen to help you maneuver this disease if you develop it. And then, are there activities for those with dementia to participate in? Yes, there are. So through the Alzheimer's Association, they actually have groups where caregivers can get together, but also patients that are dealing or people that are dealing with the community with dementia can get together. And I actually do some of these like kind of fun exercises that we'll sit down, we'll like solve complex puzzles together, to just be able to get together with others that maybe are going through the same thing you are. And then differences in Alzheimer's and other types of dementia, frontotemporal. So like I said, yep, we talked about the umbrella. Alzheimer's is the most common. Vascular dementia, second most common. This is usually when we start talking about, like I said, the recurrent strokes or depositions of like microhemorrhages that people start to develop as well. Then frontotemporal dementia. The frontal lobe is actually responsible for like who we are, like our personality. So with frontotemporal dementia, one of the key beginning signs is changes in your personality that are pretty abrupt, actually. And that actually is more pronounced than the memory difficulties. So some of these key clinical characteristics help us differentiate maybe what type of dementia it is. And then imaging is always very helpful because the area or where we see the most shrinking of the brain can also give us insight into what type of dementia you have. And then implications for treatment. The treatments that we have now, like I said, the ones that have been around for a very long time are the ones that help some of the symptoms of confusion, some of the symptoms of agitation. Patients that deal with this disease, it can take a toll in how we feel about ourselves. We were a successful business executive, and now all of a sudden I am having a difficult time following a simple family meeting. So the key with some of these treatments is, if there's depression associated with the dementia, treating the depression appropriately, making sure that you're really not dismissing the associated symptoms. If you're having difficulty with sleep, helping with those sleep pattern changes you're having. So that's why it does matter to kind of help, because the more depressed you get, the less you want to exercise, the less you want to do challenging things for yourself and kind of help your brain out. So you turn yourself into a vicious cycle almost. So that's why just talking and being on some type of medication for the symptoms is important. And then how do we compare to the other countries? Great question. So I think unfortunately our diet puts us more on the lower side of having the greatest amount of patients that deal with Alzheimer's dementia. The countries that are more along kind of the coastal regions, where their diets do comprise of mostly fish and fruits and vegetables, have a lower incidence of having Alzheimer's dementia. So the United States is definitely, unfortunately, one of those leaders for having the most amount of patients with dementia and Alzheimer's disease. Okay, what may account for the higher incidence among Black Americans, Hispanics, and women? So there is a health discrepancy, like we all know, that there are other medical comorbidities that can affect Black Americans, Hispanic Americans, and women. These are things like higher blood pressure. So Black Americans are known to have higher blood pressure than white Americans, just genetically, because of the way they, the genetic makeup is. Higher blood pressure causing an increased risk for dementia. And then for Hispanics and women, unfortunately, there is kind of that social, economic kind of disbalance, right? So not having the higher access to healthcare, unfortunately, makes a lot of these patient populations not being able to access the appropriate doctors even early on, and only being able to get that access once it's either too late or the disease progression is kind of advanced pretty significantly. And then for women, things actually like a history of preeclampsia, because of the way our vascular anatomy is, that we sometimes have a little bit of more higher fluctuations in our blood pressure, it can also increase our risk as well. And then what is the average lifespan after diagnosis? So usually after diagnosis, the recommendation, or like the thought is, we like to be transparent. We don't want to sugarcoat things and say, like, make plans for the next 50 years of your life. So on average, it's about 6 to 8 years, but actually patients live up to 30 years as well, even after the diagnosis. Because again, remember, it's a spectrum. So the diagnosis can be made near the end of that spectrum or at the very beginning. So it matters regardless, because it's being there for that support of those symptoms to just really help you live the fullest life that you possibly can. And not making this disease, and this is what I love about one of my patients, it does not make me who I am. It just makes me a part of who I, like, what I get to bring to the world, of my awareness of me still living my day, like my life day to day, making the most of every single day. So can you talk about the blood test? When will it be available? So the blood test actually has been available. So it's usually sent by one of the memory health specialists. And that's why usually primary care doctors don't always feel super comfortable sending it, just because interpreting those results might get a little bit confusing, right? We're sending a genetic test that looks at various genes. So if you have one gene but then don't have the other, then interpreting those results can get confusing. So that's why, if you really are concerned and you start having that initial conversation, getting sent to one of those like memory health specialists is key. They are all over North Carolina. I know at Duke, we do have a specific memory health clinic. That's kind of a multidisciplinary clinic. So you see one of our neurologists that's trained specifically in dementia and other cognitive impairments. They also have a social worker that connects resources. They have a pharmacist, actually, that will take a look at your medications and say, let's talk. Like, what doses are appropriate maybe at your age, what doses aren't, what medicines are appropriate, maybe which ones aren't. And then they also have physical therapy, occupational therapy, speech therapy, everything to kind of build that support system under you as you are going through this. Now, I know it's not just unique to Duke. There are a lot of centers out there in North Carolina that also have this multidisciplinary approach.
Thank you so much.
Oh, sorry.
Thank you so much, Doctor. We are so glad to have someone with your expertise here with us today. Thank you so much. You know, as a person who lives with dementia in their extended family, like my husband and I do, this has been amazing for me, and I hope it has been for you as well, and I hope you've learned a lot of things. And we thank you so much for being here today. Also, we'd like for you to know that our services are free, all of our presentations, but we do have a big Donate Now button on our website at welcomingwellnessnc.com. So if you'd like to make a donation, please feel free to do so. And thank you very much.